Signs and symptoms of MS. The lower limb defect is due to the central nervous system more likely to develop plaque as it is the longest white matter tract in the central nervous system. Patients are likely to report electric shock or tingling sensation down the spine into extremities provoked by neck flexion. This is caused by short-circuiting in the posterior columns of the cervical spinal cord. Visual complications are often the first symptom associated with MS, providing an early clinical sign. Optic neuritis is a visual loss in commonly one eye. It occurs suddenly and progresses quickly, usually reaching peak symptoms after only 2 weeks. The effects of optic neuritis include visual disturbances such as blurred vision and pain behind the eyeballs. Diplopia will occur when the nerve pathway that controls the eye function is damaged. This affects the eye's ability to align properly and usually affects only one eye. This incoordination of sight means the person with MS will experience loss of balance. Nystagmus is involuntary movement of the eye in every direction. This can contribute to dizziness and nausea. Visual disturbances are produced from inflammation or demyelination of the optic nerve that conveys image from the retina to the brain. This often causes blind spots or color disturbances. Spasticity refers to involuntary muscle stiffness or spasms, making it extremely difficult to mobilize. About 90% of people with MS experience spasticity at some point. It is not understood completely but is likely the result of demyelination of the nerves connected to muscles affected. This will then lead to excessive firing of nerves that control the muscle. These symptoms occur abruptly and only last a few seconds or minutes at most. About 4 out of 5 people will experience ataxia, which is a lack of coordination and muscle movement. It disrupts movements such as walking and speaking, as well as an individual's ability to know where their extremities are in relation to their surroundings. Sensory symptoms are due to the brain no longer being able to interpret incoming signals. To counteract this, the brain tries to relate the signal to a sensation the body has experienced before, such as being burnt or squeezed. The severity, experience, and longevity varies from person to person. Cognitive impairment disruptions include attention span, executive function, short-term memory, understanding, and speed of processing information, and concentration. These signs usually arise early in the disease and severity varies from person to person, with symptoms changing daily. Other symptoms include pain, which can be long-lasting and severe, affecting an individual's daily living. Pain can be acute or chronic. Heat sensitivity. MS patients find that heat can worsen their symptoms. Bladder and neurogenic bowel dysfunction are also experienced, which can seriously impact an individual's continence of urine and feces.